Hello friends, I am Dr. Deepak Garg and today we will discuss about the algorithm for the exposure in revision total knee arthroplasty. So our main topics will be quadriceps snips and quadriceps turn down. So what is the algorithm for exposure in revision TKA? So let's say we have a situation, we have a patient in front of us lying down on the OT table and we are planning to open the knee. So we will take the incision, we will take the approach that is medial parapatellar approach, that is a standard approach for revision TKA. We will prefer taking the incision over the previous scar and we will open the knee, we will take the knee through range of motion, and if we are able to take the knee through range of motion, we will proceed with the revision. We will open the knee, we will revise femur and tibia. So let's say we are not able to take the knee through range of motion, then we will not be able to remove the components. We will have to achieve a range of motion at least 100 degree, 0 to 100 degree. So if the knee is stiff, we are not able to remove the we are not able to achieve the range of motion. Then the first step we will do, we will first remove the hypertrophic synovium and scar. So if after removal of the synovium, again take the knee through range of motion. If we are able to do, then that is good. If not, then we will have to first release the posteromedial tibia. That is like we usually do in our routine total knee arthroplasty. If we are able to take, then that's very good. If not, then we will have to go to the next step, that is some procedure in the quadriceps muscle, and the most commonly we do is a quadriceps snip. So what are the various other procedures that we can do, we will again see in the next slides. In very few cases, even if after quadriceps snips we may not be able to reflect the patella laterally, in those scenarios we may use VY release or tibial tubercle osteotomy. So what is quadriceps snips? Let's look at the evolution of the quadriceps snip. So it starts from 1943, where Coons-Adam turn down technique came. So we will look at these techniques one by one, and then modified Coons-Adam, and then ultimately quadriceps snips in 1988. So what is Coons-Adam technique? So we can see here the medial parapatellar, quadriceps and the lateral parapatellar all are cut, and this all structure is reflected downside. This is Coons-Adam. So again, then there is a modified Coons-Adam. So in that only the medial parapatellar, lateral parapatellar is cut, quadriceps tendon is cut, and then there is a standard paramedial approach, and then the whole structure is reflected on the lateral side. So this is a modified Coons-Adam. Then there is a quadriceps snips. So we mark the incision 4 to 5 centimeter above the level of the patella from inferior to superior lateral, and cut only the quadriceps tendon, and then mobilize the rest of the tissue and reflect the patella on the lateral side. So in most of the cases we will be able to achieve the range of motion with this technique. So this is the technique that we use to achieve the range of motion in stiff knee in revision total knee arthroplasties. So this was the technique. So this is the patella. Here we can see in the demonstration, this is a patella. We are not able to reflect the patella. This is a stiff knee. Here we are planning the quadriceps snip. So we will mark we will go 4 to 5 centimeter above the patella. We will mark from inferior to the superolateral, and then we will cut it. So this was the, and then we will later resuture this with Ethivone 20 or some other adequate suture. So this was the technique about the quadriceps snip. So for VY plasty and tibial tubercle osteotomy we will have another video. So thank you for watching, and please like, share and subscribe to our channel for more such videos. Thank you guys. Thank you very much.